We are Trilogy Population Health. Today, we are going to be covering remote patient monitoring, otherwise known as RPM. Let's dive in. So, what exactly is RPM? RPM uses digital devices to gather and transmit patient data to healthcare providers, enabling remote monitoring and management of health conditions. This system allows for daily monitoring of vital signs and other relevant information, facilitating timely interventions and improved patient outcomes. Next, let's highlight some of the key aspects of RPM, which are data collection, data transmission, remote monitoring, and patient engagement. Let's start with data collection. RPM utilizes various devices, such as blood pressure monitors, glucose monitors, and scales to collect physiologic data such as heart rate, blood pressure, blood glucose, and weight. In regards to data transmission, the data collected is transmitted to a remote platform from a smartphone app through a dedicated device for review by a monitoring team. Next up is remote monitoring, where healthcare providers can remotely monitor data, identify trends, and intervene when necessary, potentially reducing hospital readmissions and improving patient outcomes. Lastly, regarding patient engagement, RPM can increase patient engagement and self-management by providing the patient with feedback on their health data and encouraging adherence to treatment plans. It is used for various conditions, including chronic diseases like diabetes, heart failure, and COPD, as well as managing acute conditions. Next, we need to determine who is eligible for RPM. The patient must have a chronic or acute condition. The patient must have an established healthcare provider and had a face-to-face visit in the last year. The patient must provide consent for RPM services. The patient must have cellular data or Wi-Fi access. And insurance has to approve the services offered. So who are the approved providers for RPM? Physicians, nurse practitioners, clinical nurse specialists, and physician's assistants are all approved providers for RPM. Let's discuss the RPM device requirements. First, it must satisfy the Food and Drug Administration's definitions of a medical device. Next, it must be a digital upload of the patient's physiological data, and it cannot be self-reported. This way, the data holds both reliability and validity. The use of RPM must also be considered reasonable and necessary based on the patient's condition and medical history. When it comes to RPM and billing, we need to have at least 16 physiologic readings a month to bill for RPM services. We also must have at least 20 minutes of interaction with the patients each month. Be sure to provide patients with a way to contact a practitioner or clinical staff 24/7. Ensure continuity of care by scheduling appointments, and provide enhanced communication opportunities by utilizing telephones, secure messaging, internet, and the patient portal.